Dr. Michael Wheeler, orthopedic spine surgeon. We're going to continue our discussion about surgical approaches to the neck. Today, we're going to cover some of the downsides of coming from the back of the neck or the posterior cervical approach. Okay, as I've covered in previous videos, everything we do, both in life and in surgery, there's pros and cons. Okay, the pros of coming from the back of the neck, it's a salvage operation. We can oftentimes fix a lot of problems, people who need a whole lot of fixation. It gives us access from the skull all the way down to the thoracic spine, compared to the front of the neck where we only have access down to C7 or sometimes T1. Downsides of coming from the back of the neck. A little bit of a longer surgery usually, longer recovery, a little bit more painful recovery. To do the surgery, you have to make the incision, peel the muscles apart, do your work, and then sew them back together. So there's a longer period where that wound has to heal, and it is associated with a little bit of a higher rates of wound drainage, wound complications, and infections. So those are some of the downsides of the posterior approach. But again, everyone's situation is individualized. Not all things can be done from the front. Not all things can be done from the back. That's why it's important to weigh your individual situation with your surgeon and come up with a plan that makes the most sense for you with your unique situation. Follow along for more questions and answers about spine surgery.